Hi, I'm Belle from Be Well Dental, and today I'm going to talk to you about gum disease as part of Dental Health Week. There are two main types of gum disease, gingivitis and periodontitis. Let's talk about gingivitis first because it's the most common gum disease that we do see in the clinic. Gum disease is a result of poor oral hygiene, where plaque builds up around the neck of the teeth at the gum line. This causes the gum to become inflamed, and inflamed gums will become red and puffy. So when you brush and floss your teeth, your gums will bleed. Hence, when you floss and brush and the gum bleed, that's a sign of gum disease, as normal gum do not bleed. How do we treat gum disease? Well, good oral hygiene by brushing your teeth twice a day at the gum line, floss every night or use interdental cleaning tools to clean in between your teeth, and visit your dentist regularly for a professional clean. Periodontal disease is the extension of gingivitis, where you have long-term gingivitis and the bacteria starts to migrate down the root of the tooth. Bacteria, when it migrate down the root of the tooth, is an irritant to the gum. So the gum will actually pull away from the root of the tooth and create a space called a pocket. Then more bacteria can collect within the pocket and causes erosion of the bone. So periodontitis will result in the loss of structure. It will result in loss of gum, loss of the ligament that hold the teeth in place, and loss of bone that hold the teeth in place. So usually a common presentation of gum disease is recession, where the roots are exposed, sensitivity because roots are exposed, bleeding gum, loose and mobile teeth, as well as tenderness to biting. Who are at risk of having periodontitis? Well, ongoing poor oral hygiene, failure to treat the gingivitis, family history of gum disease, a smoking habit. People with diabetes tend to have an increased risk of gum disease. There are other factors that can increase your risk of gum disease, but the most important thing is to keep your teeth and gums clean. How do we treat periodontitis? We need to clean the teeth. So we need to scrape the plaque and tartar away from the root of the teeth so that the gum can heal and reattach itself to the root of the teeth. The missing structure, gum, ligament, and bone that has already been lost will forever be lost, but a controlled periodontal condition is when there is health of the gum, and then we can prevent further loss of the periodontal structures. Did you know that our overall health of the mouth is also important for the overall health of the body? It makes sense because the mouth is the gateway to the digestive system. It is also the gateway to our respiratory system. There has been study to link poor oral health to respiratory condition, to irritable bowel syndrome, to increased risk of type 2 diabetes, increased risk of cardiovascular disease, premature birth, as well as neurodegenerative disorder. So it's really important for us to maintain good oral health in order to have a fresh, clean, healthy mouth, but also to have general well-being. Thank you for listening.